Hello and welcome to Medical Dialogues. I'm Anshika Mishra. Here's what I bring to you from the world of medicine. Study finds higher stroke risk by age 55 for women with excess weight as teens or young adults. In an analysis of more than 50 years of health data, women who were overweight or obesity at age 14 or 31 were more likely to have an ischemic stroke before age 55. According to research published in Stroke, the peer-reviewed scientific journal of the American Stroke Association. According to the American Heart Association, an ischemic stroke occurs when a vessel supplying blood to the brain is obstructed. Ischemic stroke is the most common type of stroke and accounts for about 87% of all strokes. The study suggested that women with overweight at age 14 were associated with later clot, caused stroke risk despite having lost weight by age 31. Also, women with overweight at age 31 were associated with later clot, caused stroke risk despite having been normal weight at age 14. An increased risk of clot caused stroke was not found in men who were overweight at ages 14 or 31. However, men with obesity at age 31 had a higher risk of bleeding stroke compared to women with obesity at age 31.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
New study shows differing effects of obesity and metabolic syndrome on breast cancer. A study conducted by University of Oklahoma and published in the journal Cancer found that both obesity and metabolic syndrome, a cluster of conditions like high blood pressure and high blood sugar, increase the risk of breast cancer but in differing ways for different subtypes of cancer. Breast cancer is one of the most prevalent cancers globally, significantly affecting women. It is the most common cancer among women with millions of new cases diagnosed each year. According to the World Health Organization, breast cancer accounts for approximately 24.5% of all cancer cases in women, making it a leading cause of cancer-related deaths. In the study, a total of 68,132 postmenopausal women without prior breast cancer and with normal mammograms were enrolled in the Women's Health Initiative randomized clinical trial. The study population consisted of 63,330 women with an entry metabolic syndrome score. At the start, BMI was determined and the metabolic syndrome score included the following criteria: high waist circumference, high blood pressure, a history of high cholesterol, a history of diabetes. The study outcome included breast cancer incidence, breast cancer mortality, death following breast cancer, and result categorized by hormone receptor stages. Endocrine Society releases new guidelines on vitamin D for disease prevention. The Endocrine Society's annual meeting revealed guidelines on vitamin D for disease prevention, emphasizing the restriction of vitamin D supplementation beyond the daily recommended intake to certain high-risk groups. Additionally, the guidelines advised against routine 25-hydroxyvitamin D testing in healthy individuals. The guidelines were published in the Journal of Clinical Endocrinology and Metabolism. A team of clinical experts, along with experts in guideline methodology and systematic literature review, identified and ranked 14 clinically relevant questions regarding the use of vitamin D and 25-hydroxyvitamin D testing to reduce disease risk. They prioritized randomized placebo-controlled trials in general population, assessing the impact of vitamin D supplementation across all age groups. The grading of recommendation, assessment, development, and evaluation, that is the GRADE methodology, was employed to evaluate evidence, certainty, and inform recommendation. The guidelines advise that people who may benefit from vitamin D supplementation include children aged 1 to 18 years to prevent rickets and to potentially lower the risk for respiratory tract infection, pregnant people to lower the risk of maternal and fetal or neonatal complication, adults older than 75 years to lower the risk of mortality, adults with prediabetes to lower the risk of type 2 diabetes. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.